Hey guys, today we are going to discuss a very beautiful topic, that is gynecomastia, also known as gynecomazia. When there is a breast like swelling in males, the condition is called gynecomastia. The breast is enlarged to certain extent while nipple and areola may or may not assume the same feminine characteristics. Slight swelling of the breast in adolescent boys is common. This is due to hormonal changes. This condition may be unilateral or bilateral. Pathophysiology of gynecomastia. Physiological, it happens in all age group, in neonates, adolescents and old age. In adolescents, it is due to excess estradiol related to testosterone. In old age, testosterone levels fall significantly. Pathologically, we divide into following condition. First condition is estrogen excess. Second condition, androgen deficiency. Third is secondary, and fourth is drug. Now, first, estrogen excess. This may result due to excess secretion of the estradiol from testicular growth or non-testicular growth. First, testicular leading cells, Sartorius cells tumor, choriocarcinoma, embryonal carcinoma. Non-testicular tumor, that is adrenal cortical neoplasm, lung carcinoma, hepatocellular carcinoma. Endocrine disorder, that is hyperthyroidism, hypothyroidism and hepatic disease, that is alcoholic or non-alcoholic liver cirrhosis may initiate estrogen excess, which leads to formation of gynecomastia. Now, second condition, androgen deficiency state. Physiologically, we see in 50 to 70 years there is a physiological deficiency in androgens, and other certain conditions are Klinefelter syndrome, Kallmann syndrome, congenital anarchia, defect in androgen biosynthesis, and ACTH deficiency. Third condition is secondary testicular failure may cause gynecomastia due to trauma, orchitis, cryptorchidism, hydrocele, varicocele, spermatocele and renal failure may initiate gynecomastia. Fourth condition is drugs which inhibit the action or synthesis of testosterone, that is cimetidine, phenytoin, spironolactone, diazepam may initiate gynecomastia, and other drugs that enhance estrogen synthesis may also induce gynecomastia, that is reserpine, theophylline and furosemide. Pathology, generally gynecomastia is idiopathic in nature. Breast shows proliferation of fibrofatty stroma and duct without acinar growth. Now, we are going to discuss the clinical features. Patient usually present with no other complaints except abnormal enlargement of the breast. Unilateral enlargement of the breast is most common condition and in idiopathic condition. Though it is painless in condition, palpation reveals of normal breast which is not tender, movable over the underlying muscles. Treatment, it resolves itself in androgen deficiency condition. Administered the testosterone will help in resolving the disease. Some drugs, that is danazole or tamoxifen, may improve the condition, or most favorable is oxygen. Thank you for listening. Subscribe to my channel to motivate me to study and hit the bell icon for never miss an update. Thank you.